So I'll start off with telehealth, and often when we talk about telehealth, people get a bit nervous that we think that people think that video call replaces face-to-face care, and absolutely I don't believe it does. I think the exciting thing about telehealth is that it can offer hybrid models of both face-to-face and telehealth-based care, which can do a couple of things. It can improve access for patients and mean that people don't have to travel a long way. If they can't drive, they don't have to get public transport or have someone drive them. And it can also increase capacity for our healthcare professionals and support networks. So that's about, we do know, we recognise that there are workforce shortages across our catchment and across many other places in Australia at the moment. And I heard a great story the other day of someone who was seeing a psychiatrist in another country. So it opens up the options to be able to access care, even if we've got a workforce shortage in a certain area. And the other thing it can do is we've got things like case conferencing. So if you needed to include several people in a conversation or have a GP talking with another allied health professional in terms of a patient care, it's a bit easier to set that up when it's a video call rather than trying to get people from across the region in the same spot at the same time. So as I mentioned, we support the use of Health Direct video call platform, which is government funded, Commonwealth funded. And we can provide support with the registration, so the sign up, and of course support and training and workflow support on how you can actually make it work in a clinic setting. Beautiful thing about Health Direct is that it is free for general practices, Aboriginal medical services, and Aboriginal community controlled organisations. It's also free for health professionals who work in aged care, allied health, Indigenous health, maternity health and mental health services. We've seen a huge rise in telehealth being used in mental health services. And the other good thing I like about Health Direct is that it's easy for patients to use. They don't need to download an app. They don't need to install software. It's a simple URL link that opens up to a web-based video room. So there's no sign up required. It can be sent by SMS or email, and they just click on the link to open up that room and you get popped into an electronic waiting room, hopefully with music playing. I like it when there's music playing. The last thing I want to talk about quickly is GoShare, which is our patient education and health literacy tool, and I'm going to give you a little look at it. So basically, GoShare is an easy to use web-based platform for health professionals to help. So it enables them to share reliable, targeted, and timely evidence-based health information with their patients. There's an ability to share videos of patient stories, animations, fact sheets, and online tools. And once again, it's really easy access for patients. So they don't have to log into something. They don't have to download an app. They receive via email or SMS a simple link to click on, and they can view that information. And because it is a link, that information is kept up to date. So for example, if you are sharing some information from Cancer Council Australia, they if they update their resources, that link will obviously lead to the most updated resources. So it's a good way of making sure that information is kept up to date. And obviously WVPHN, working with them, we provide general practices with we fund the licenses, and we also run little campaigns and support sessions to help health professionals use it. And we can facilitate the adding of existing information. So if there is existing information online, we've got a process we can go through with GoShare to have that added to the platform. And we've also can potentially develop new content, help them develop new content, whether that's patient stories with lived experience, and we can have that added to the program. That does require funding, depending, wherever that might come from, but we can facilitate that happening and support that work. So what I thought I might do very quickly is give you a little insight look at the platform, and this is from a health professional perspective. They log in, it's very simple to use, and there's a few ways to go about it. You can search for topics here, and all the resources will come up. Or there are obviously these tiles. And I have been talking with the Spider team about the potential to add in a tile here to support people with intellectual disability and have some content put in there. So I'll give you a quick look at how it works. I'm just going to, for example, click on asthma in adults. And what I think one of the biggest strengths of GoShare is that it's got these patient stories of people who have been through these experiences or had these conditions. And it's these patients talking about their experience, whether it be with a new diagnosis, finding the right treatment. And I might just show just a couple of seconds of the video, and I hope this works. My last video went okay, to give an idea.
When I was really little, I was sick a lot with a cough, and that was quite a long time ago, and I'm not sure that I was actually diagnosed correctly. I thought I had asthma, but it was nothing really to worry about. I volunteered for a research study in my late 40s, and that nurse that I met there did some testing. It concluded that I had significant asthma. She provided me with all this information and actually just educated me about what asthma is and how to manage it better. And so that was my turning point, I think.
So I do recall my mother taking me to the GP when I was probably about 7 years old and saying,
now, sorry, in the interest of time, I might not watch the whole video, but you get the idea that it's got patients there talking about their own experiences and providing information, which is a huge strength. They also have animations and other videos available, and if there are existing videos on the internet, we could potentially have them added. There's info sheets, often in different languages. And there's apps and tools, which might be, a questionnaire that gives advice. They tend to only add information that comes from peak bodies and evidence-based information, with the idea that we want an opportunity to provide reliable information to patients rather than going to Google or YouTube and going down that rabbit hole. So what health professionals can do is just add things to a bundle, which, as you can see, collects up here. If you click on what's going on there, you can see I've got all my saved bundles that I've created before. So we could create bundles and push them out to general practices all ready to go to be used. You can also create schedules, which means that if you only want to send one video a week for the next 4 weeks so that you're drip feeding information and keeping patients engaged in that learning journey, you can absolutely set that up so it automatically sends at different increments. And all you have to do is send that bundle, and you can have all your patients stored in here. So if I put in myself, it will actually come. No, it won't. I'm not saved. I wonder if anyone is. You get the idea. So you would have your patients loaded in there, or it is really easy if you want to add a new patient, you just put in their name, email, and or mobile, and the patient receives a really easy text that says, Sarah from Torquay Clinic has sent you a bundle, click here to view. Now they will have that in their phone forever, and they'll be able to, provided that content's still available online, they'll be able to access that whenever they want. There's no login required. So that is our GoShare, our patient education tool, and we've got we're going to be providing more training and be promoting that a bit throughout the year.